hematology, oncology, pathology, red blood cell morphology. So the first thing that I'm going to be talking about is just red blood cell morphology as well as inclusions, just because that in order to understand the anemias, we have to understand what we can see on the red blood cell smear, the peripheral blood smear, as well as in different types of stainings. So the first high yield thing that we have to understand is if we see a dacrocyte. And a dacrocyte looks like a teardrop cell, and that's why they call them dacrocytes, which just means teardrops. And the pathology that it's associated with is bone marrow infiltration, which is seen in myelofibrosis. It's not that high yield, but it's something that you should be able to recognize. And make sure to look these up as you follow along with these. Next, and probably the most high yield thing, is schistocytes. Schistocytes are just sheared, fragmented red blood cells. So if you see small little pieces of red blood cells floating around in the peripheral blood smear, you know that you're looking at schistocytes and that it must be some type of pathology that leads to the shearing of red blood cells. The main ones that are the main pathologies associated with schistocytes in the peripheral blood smear are going to be any MAHAs, which we'll talk about later on, the anemias. This is microcytic angiopathic hemolytic anemias, and that's going to entail DIC, TTP or HUS, or HELP syndrome. Also, it can be due to mechanical hemolysis, so any heart valve prosthesis it could potentially lead to schistocytes being seen on our peripheral blood smear. Next is degmocytes, which is more popularly known as bite cells, and this is the easiest one to see because it genuinely looks like there's just a bite taken out of these cells. And the reason behind it is because the associated pathology with degmocytes or bite cells is G6PD deficiency. And as you'll see with the pathology when we talk about it later on, is that the spleen, the splenic macrophages, is trying to remove these Heinz bodies from the G6PD patient that has degmocytes. And the way that they do it is they just take a bite out of these cells, leading to the bite cell look. Next is spherocytes. Spherocytes are just these round, essentially just spherical red blood cells. We don't normally see that because a normal red blood cell morphology is going to be looking like a biconcave shape, and you should have central pallor. However, if you see a red blood cell that just looks round with no central pallor, that means it's decreased its surface area to volume ratio. They have no central pallor and they're small spherical cells. You're going to see this associated with hereditary spherocytosis as well as autoimmune hemolytic anemia or AIHA, which we'll discuss later on. Next is target cells. Target cells have an increase in surface area to volume ratio, and you can compare and contrast that to spherocytes, which have a decrease in surface area to volume ratio. So be aware of that. And target cells associated pathologies are very, very high yield. They love to ask about them, and it's going to be hemoglobin C, any patient that is asplenic, liver disease patients, or any thalassemia patients are going to be seeing target cells on peripheral blood smear. So don't forget those four key associations. Lastly, sickle cells. Sickle cells, everyone knows what they look like. They look like a sickle, and it's just like this needle shape, and it's associated with the sickle cell anemia. And the reason that it occurs is due to the fact that there's going to be low O2 conditions, and that's when we're going to start to see sickling of our red blood cells. And so then once we start to sickle, it leads to a issue with red blood cells flowing properly through the small vasculature of our body, and that's why it's known as kind of a vaso-occlusive disease. But that's all for red blood cell morphology for the peripheral blood smears. And the last thing I'm going to be talking about is red blood cell inclusions. Now, the inclusions are going to be seen either in bone marrow or peripheral smears. So you have to be able to kind of decipher the differences. The first thing, and the only thing that we're going to be seeing really in bone marrows, is going to be iron granules. So if I see a patient that requires Prussian blue staining, I'm automatically thinking of iron. Okay, so if they ever say Prussian blue stain, and then you go and you look at the staining, and it's this bright picture with pink colors and light blue colors, we rarely ever see that, and that's going to be indicative of iron granules, and we're going to be seeing that associated with the pathology of sideroblastic anemia, which can be caused by multiple things, but lead poisoning is one of the main causes of that. And the reason we see this is just an excess of iron forming a ring around perinuclear mitochondria. Okay, and so these are known as ringed sideroblasts. And we're going to talk about the pathology later, but just make sure you are comfortable with seeing what iron granules look like from a bone marrow tap. That's very important. This comes from the bone marrow. Next is going to be the peripheral smear. The first thing we're going to be seeing is Howell Jolly bodies, and this is going to be seen in patients that have basophilic nuclear remnants. The reason that they have this is due to the fact that the spleen has been removed. So in patients that have asplenia, whether that might be due to surgery or due to sickle cell disease, but anytime that the patient is asplenic, there's no spleen available, they cannot remove nuclear remnants from red blood cells. And we know that red blood cells do not have any organelles or any nuclear remnants because there's no nucleus. So the presence of these is going to be highly indicative of asplenic patients. Next is basophilic stippling, which is also seen in sideroblastic anemia, just like our iron granules, but this is going to be seen in the peripheral smear, whereas the iron granules were seen in the bone marrow, and you needed a Prussian blue stain. For this, you don't use a Prussian blue stain, and we see basophilic stippling, which is just like blue dots seen on peripheral blood smear. And all it is just ribosomal remnants. It does not contain iron, whereas the iron granules obviously contain iron. That's why we need the Prussian blue stain in order to see it. Lastly, and most importantly probably, is the Heinz bodies, which we already discussed is seen with the pathology of G6PD deficient patients. And all it is it's denatured and precipitated hemoglobin. So what does that mean? It just means that the hemoglobin is going to just clump together and form these little bodies known as Heinz bodies. And that's what happens when we have the splenic macrophages taking bites out of these red blood cells in order to lead to the bite cells seen in G6PD deficient patients.